Hey, welcome, friends. This is Mike Collins, owner of Healthway Compounding Pharmacy in Saginaw, Michigan. And my Santa hat with me today is Dr. Keri Tapuzian.
I want one of those.
Yeah, you do?
Yeah, I think I'll look more professional seeing patients with it.
Probably would. You probably had a hard time keeping a straight face as they're talking
Well,
to you.
it's it's always good to have a physician that has a sense of humor.
Well, I think so too. I think so too. I mean, I would identify with that.
Yeah, and it shouldn't all be. You should try to have a little fun when you go see your doctor too.
Yeah.
I guess.
What can you do?
Hopefully.
Yeah, hopefully you do. So today's topic. Sorry about that. My tongue got tied there a little bit. We're going to talk about female testosterone.
We are.
Yeah.
Oh, okay. All right.
So female testosterone, and a lot of women don't realize that testosterone is made by the ovaries and that it's a female hormone. They just think of testosterone as a male hormone. So tell us a little bit about some of the issues that patients come in for that might think about replacing female testosterone.
Well, yeah, and a lot of times women just don't realize that they may need testosterone, and there's some telltale signs that you can look at to try to give you an idea if you need testosterone. Some of them are. I'm just going to show you this one thing. Like what I'll do with women is I'll have them look at their fingers, and if their index finger, this one, is shorter than their ring finger, then they may be testosterone dominant, or it may be their hormone of choice. Other things is that what testosterone helps with in women mainly is sleep, energy during the day, libido, sense of well-being. So if you're having any of those symptoms, you might need some testosterone. Okay. Also, if when you were younger, if you were athletically inclined, or if you were good at sports, or if you were a tomboy, then that says that, well, maybe testosterone was one of the hormones that you may need. And a lot of things will lower your testosterone levels in women. For example, if you had a partial hysterectomy, and they take out 1 or 2 of your ovaries, then a lot of times your testosterone levels will drop. After childbirth, your testosterone levels will drop. Stress, your testosterone levels may have a tendency to drop. Going through perimenopause is another reason. So there's a lot of situations. If you're birth control pills,
I was just going to mention that.
Yeah.
Sometimes we think of testosterone only in menopausal women because their ovaries stop functioning, where we make the testosterone in women, and so a lot of times they don't realize that birth control, oral contraceptives, or any kind of contraception that causes the ovaries to shut down. Once we shut down those ovaries, we've also shut down not only estrogen and progesterone production, but we've shut down testosterone production too. So even younger women can go to their physicians complaining of low libido or difficulty, with stamina or some of the strength issues if they're strength training or things like that, and they may come to you with issues looking for testosterone. Correct?
Sure, absolutely. So then also, you should ask me now. So how do you replace testosterone?
So how would we replace testosterone?
Well,
That's a good question.
I'm glad you asked me that. So luckily there's such a thing as a compounding pharmacy, because
that's us. That's me.
The most common way that we'll replace testosterone and other hormones with women is transdermally on the skin or vaginally. And the reason is because at least vaginally you get better absorption, and you don't have to use as much. That's the most common way. You can also take it as a pill or a sublingual underneath your tongue. Doesn't work as good that way, but every once in a while we do use it that way. You can also do it as an injection, where you give yourself a shot once a week. Sometimes that's like the perfect way for women. Other people are like, what, are you crazy? I'm not giving my shot once a week.
Yeah, they don't like that.
So it just depends. It depends on the person.
Sure.
And what works well for them. And then there's also pellets, where I actually put testosterone underneath your skin, and it slowly absorbs over a 3-month period of time.
Oh, that's great. Well, that's good. So I think that could wrap up our talk on female testosterone today. Sure. And stay tuned now to fix your husband or significant other, because we're going to talk about that on the next little program here. So thanks for being with us, Dr. Tapuzian.
You're welcome.
And
glad to be here.
Tune in again. Stay healthy, my friends.